So it's been a while. I get it, a couple months, but I've just been, doing my thing. I figured I'd have the day off finally, so I figured I'd update with everything I've been doing for the past couple months. I'm on surgery right now, so it's been hell. It's been crazy because you work all these ridiculous hours, but it's super neat to see a bunch of stuff. I don't know, surgery's going pretty well, but that's not the point. The point is, I spent 2 months doing medical rotation stuff, and my lizard spent 2 months getting huge. So look at this guy. Look how huge he is now. He's massive. Remember when he was like literally the size of my finger? He was running around being an idiot. Now he's literally huge, massive. So that's his update. That's his internet appearance for the day. He's gonna go back to just sitting there. But so I spent a month on addiction psychiatry, and that was awesome. That was so much fun. But the way we did it, the physician I shadowed did really different. He did everything in an outpatient setting, and he never did any like kind of maintenance drugs. So we weren't just dishing out Suboxone, we weren't just dishing out methadone, we weren't managing chronic people like that. Everything we did was 100% like you had to be ready to quit because you were stopping everything, and we kind of treated the symptoms for a week intensive, non-addictive medication supplement, and in addition with intense psychotherapy like every day for a week, and then twice a week for a couple months, and then we bumped it down to once a week, and then pretty much by 2 months after I think your stop date, he had like a 92% chance of keeping people sober. Um, so that was excellent. It was a really good rotation. The attending treated me like a resident, so I basically had my own patient base. I was, gave me an idea of what it's going to be like to kind of run your own clinic and kind of follow up with patients and stuff. Because I had to schedule every follow up visit, I had to, in my schedule and his schedule. Um, he came in for we were doing about an hour of therapy every day. He would come in for about 10 minutes, do his, quick update, and then I was kind of just left on my own. What you looking at, bro? And so that was excellent. I really had to step up my game, and I really had to learn to know what I was talking about because there was no hope if I didn't know what I was doing. There was no hope. So, and it was great. He gave me 100% on my review. He told me he's very happy that I caught on so quickly. He gave me some pretty difficult cases, and he knew that, and he recognized that, and he said that, there were a couple of times that I left the room and I didn't know, I felt kind of bad leaving with this person because I knew they might have been a problem. Uh, so that was, it was really good. It really tested my knowledge because it was in a big hospital, um, as opposed to the little community hospital I work in now where, you don't really see anything. Um, but it was excellent. I give the guy a lot of respect for what he does because I really was kind of interested in addiction, but I knew I didn't want to just sit around and dish out methadone for a living. Um, and that's exactly what he did. And I had people from all walks of life. People who were, oh oh my god, he just pooped. Oh my god, get off of my computer right the fuck. Oh my god, he literally just pooped on my. Oh boy, this is okay. All right, we're done here. We are absolutely done. We are done right now. Oh my god, he's pooping in my computer. I can't right now. Oh my gosh. Oh. Oh, you motherfucker. Oh, I knew you were gonna do this. Oh my god, it couldn't even be a little bit, could it? You had to just explode everywhere. Cut! Well, that little tragedy's been sorted out. And he's just kind of chilling, like, oh, whatever. Whatever. Luckily, he didn't go in anywhere. Any of, like, the keyboard or mouse pad or anything. Now it just stinks. It smells rancid in my frickin' apartment. I'm sorry for my vanity. I'm sorry I just decided to flip out on all of it. Oh my god. I wasn't gonna show you. I'm sorry. I know you should have seen the aftermath, but I'm gonna spare everybody because you Oh my god. So addiction medicine was great. I can't believe I just. Oh, addiction medicine was great. I don't think it's for me. I've kind of ruled that out as a subspecialty now. I really wanted to do it. That's why I did spend an elective month doing it in Syracuse. Um, but I don't like just talking all day. I thought the medical man just smells so bad. You smell terrible. Don't look at me like that. Put your goddamn tail down. Stop it. And So the medical part of it was cool. The medications were neat because these people have all these other problems, but you can't treat them with certain things because of their, addiction capabilities. But so that was neat. Yeah, yeah. Other than the outpatient stuff, the office was about a block away from the hospital. Get off my computer! I do not trust you. And so, anytime we had a consult in the ER, somebody came in an acute detox, and we were admitted to the medical surgical floor. We would have a go over and consult on them. Hey, I had to learn my way around a hospital system. I had no idea where the hell or what the heck was going on. So that really tested me. But by the end of it, I had a patient who was basically on their deathbed, and it was tough. It was tough to see, but I don't know whether or not they made it. He got admitted, I think, like 3 days before I quit the service, and had to move onward. But it was bad. It was sad. He had no idea what was going on, where he was, hallucinating up a storm. Not being able to control him with anything to save his life. And it was tough. But it was super rewarding by the end of it. When you really see someone turn their life around. I had 1 or 2 patients come in, sort of, when I started. When I during the very beginning of my 4 weeks, and by the end of the week, their lives were completely turned around. Their relationships were better. They were doing better at work. They were getting better jobs. I got thanked a lot, and a lot of people said, I made a huge difference, I guess, in their life, and that's really, the best part about, being a physician and kind of going there and, helping people out when they most need it. So that was great. I'm in awe of that rotation. It was probably the best one to date in terms of my responsibilities and what I had to do and what I got to do. But, so, that was cool. Family med. Family med. It's just not my thing. My doctor was awesome. His patients were super cool, and they loved him. He'd been seen like parents and kids and grandkids. He kind of just knows the whole family, and that from the takeaway is probably my favorite part about family med, because I know I want to do some kind of specialty where I get a patient following, or where I get the patient, like the continuation of care. I don't really like the treat them and treat them mentality that you'll see with like ER or surgery, or an acute, maybe a GI thing or something like that. But I definitely want, something more patient following oriented. And Family Med was good for that. But I think literally 90 to 95% of what we saw in the office was just prescription refills. People coming in for their 3-month checkup, for their yearly checkup, just ordering blood work. So it was a little too boring, too routine for me, and that's when I check out. If anything falls in, to a routine, it's when I get bored and I check out and I get miserable. So I need something that changes all the time. I think something with the continuation of care, and I need something that's a lot of fun. So Family Med wasn't for me. We saw a stomach bug at one point. I think a couple people with sniffly noses, but it's really just not for me. If it is, but you do get the patient care aspect of it. You do get the following. You do get a very, very loyal fan base. So fan base, patient base, or fan base. I don't care. I don't know. That's been going on for the past 2 months. My lizard's been growing. I've been bouncing all over the place. I was in Syracuse. I was in Pittsburgh. I'm back in a different city now. For 2 months of surgery. Month after that, we go into Virginia Beach for OB-GYN, because it's really what I want to do. Month after that, I'll do another elective in OB-GYN at another hospital. Probably a program that I'm interested in, so I can really get in there and audition and make people, know them kind of amazing. Yeah, that's a life update. Nothing new and exciting on the personal life front. Studying all the time. Happy New Year, Merry Christmas, Happy Thanksgiving. Kind of missed all those. But yeah, so that's it. Yeah, if you have any questions, comments, things you want to see, leave me a message, leave me a comment down there. You want to follow me on Instagram or Twitter at Michael J. Albring. I'll put the links below. So you can kind of get a daily update, as opposed to every 2 months or when I find time. But sounds good. Hope everyone's doing well and enjoying wherever you are. I'm in the freaking north, so it's a snowpocalypse everywhere. I think we got 6 inches overnight. It snowed all day yesterday. Roads are completely covered everywhere, but Woke up at 6 and went to the hospital by 7 to make sure everything was in order. So there's no 2-hour delays in medicine. There are no days off in medicine. There is no, oh, the weather was too bad in medicine. You're going to work. And now I'm just kind of hanging out for the day. Nip Tuck's pretty cool. I started that, even though I'm like, I guess years behind, but whatever. Anyway, all right. Talk to you guys later. Bye.